Welcome to today's press briefing. We have with us Undersecretary for Health, Dr. Libby Lee, Controller of the Center for Health Protection of the Department of Health, Dr. Edwin Choi, and Director of Cluster Services of the Hospital Authority, Dr. Simon Tang. We'll first hear from the Undersecretary. Members of the public, friends of the media, good afternoon. The purpose of today's press conference covers a number of topics. First, we're aware that members of the public and the media have a lot of questions in relation to policy. So I would like to take this opportunity to answer your questions. And there are also changes in hospital service availability. So we would like to hold regular press conference to give you information. This is today's flow. First, together with the Department of Health, we will give you information about COVID after relaxation. Afterwards, we'll hear from the Hospital Authority about adjustment of services. Afterwards, I will give you information about the situation after relaxation. Say, for example, in situ isolation, social distancing measures, as well as the vaccine pass. I'll first defer to Dr. Edwin Choi and then Dr. Simon Tang. Good afternoon, everyone. First of all, I'd like to report to you in relation to the COVID situation in the past week. In the past week, we find that the epidemic situation is stable. For daily number of cases, we have about 3,500 to about 4,020, average about 3,700 cases. In terms of imported cases, it ranged between 117 to 245 in the past week, so about 180 per day. The number of imported cases about 3 to 5% of our daily number of cases. In relation to imported cases, generally, we are able to identify about 75% of the cases within 3 days of arrival. Cases reported by schools continue to drop. It's about 405 to 1,000 or so. So it involves 200 schools or so. So in the past 7 days, we have heard from about 30 care homes for cases, 21 RCHEs and 9 RCHDs. So on average, about 2 to 8 care homes have reported cases to us, involving 2 to 18 people. In terms of variants, we continue to monitor if there is any major changes. For BA.5, this subvariant, we find that it is the prevalent subvariant. It accounts for about 85% of the cases involving subvariants. The figure stays the same in the past week. So we do think that for BA.5, it has plateaued. That's all for me. Thank you. Now we hear from Hospital Authority, Director of Cluster Services, Dr. Simon Tang. Good afternoon. I would like to give you a report about the latest situation of the Hospital Authority. At the beginning of September, we had about 3,000 confirmed patients staying in hospitals. At that time, the daily number of admission of new cases is well over 400. However, in the past few weeks, with the stabilizing of the epidemic situation, we have 1,700 patients staying in hospitals, a drop from 3,000. The number of new cases of admission has dropped from 400 to about 150. In terms of critical cases and serious cases, there is also a marked drop. A few weeks ago, we had about 100. We had over 100. It has dropped to about 60. With the stabilizing epidemic, this has greatly alleviated pressure on the Hospital Authority in our admission. So we will make adjustments to our services. We will increase number of beds, manpower, and service capacity for the needs of non-COVID patients. we will put in place a series of measures. First of all, in terms of the hospital bed deployment plan, we have now changed it from phase 3A to phase 2. That means we will mobilize beds planned for COVID patients to non-COVID patients. For the AWE treatment center for COVID, it will become standby today. In relation to the number of beds at North Lantau Hong Kong Infection Control Center, it will drop. Manpower stationed at these two facilities will go back to the hospital they came from. Previously, we have cut non-emergency services. They will be reinstated gradually. Currently, for non-emergency service, it has resumed to about 80% of our normal capacity. For specialist outpatient, we will resume the number of quota. General outpatient services suspended will resume. We use a risk management approach. We have made adjustments to visitation of non-emergency wards of 26 hospitals. We will make adjustments to the frequency of visits and the number of visitors. Of course, we will continue to monitor the situation. We do hope that the expanded visitation arrangement can be expanded to other hospitals. However, if the epidemic situation continues to stabilize, we are fully prepared to further deploy manpower back to their original posts to serve non-COVID patients. Thank you. Well, we have launched the 0+3 quarantine arrangement. So we would launch the in situ isolation arrangement. In the past, for those staying at the hotels, if they are confirmed with COVID, they will be transferred to isolation hotel. Well, under the 0+3 arrangement, for those staying at quarantine hotels, if they turn out to be COVID positive, they can, at their own expenses, continue to stay in the same hotel or guest houses for isolation. If they are unable to pay for their own fees to stay in the same hotel or guest houses, then they will be sent to isolation hotels. Isolation at the same hotel is actually similar to members of the public staying at home for isolation. The risk can be controlled. At the same time, this will save the patients from having to travel. This will be a better use of resources. And we have also, in this way, reduced the risk of transmission where in transit. Currently, we have contacted 60 designated quarantine hotels. At least 35 of them said that they would welcome the in situ isolation arrangement. Today, we will issue to 2,000 hotels and guest houses the latest guidelines on prevention of COVID-19 for hotel practitioners. We hope that when activities resume, there will be appropriate prevention measures put in place in order to reduce the risk. Shortly afterwards, we will make use of virtual meeting to explain in detail to hotels and guest houses about relevant prevention control measures and administrative arrangements. We will also send our staff for site inspection to explain to them the details.
除此之外，喺
Regarding 0+3 arrangement.
日正式
Well, we have the new quarantine arrangement 0+3. It's only been 5 days, so we still need further data to see whether we need to make further adjustments. But as you have heard from Dr. Tsui, the local epidemic situation is stable. And for local healthcare services, we have the room to resume normal capacity. So when we want to use a minimum of resources and with precision control the epidemic situation, we will appropriately relax measures. We want to protect public health and at the same time enable resumption of activities in our economy and people's lives. And these are our relaxation measures. In the next cycle, that is from the 6th to the 19th of October, for catering business premises and scheduled premises under 599F, there will be relaxations in the following terms. For catering business premises, the number of people per table will be increased from 8 to 12. At the same time, the number of people allowed in scheduled premises will be increased to 12 from 8 people. These are amusement game centers, bathhouses, fitness centers, etc. In terms of clubs, nightclubs, bars and pubs, number of people allowed per table will be increased from 4 to 6. Number of people in a banquet at catering business premises will be increased from 120 to 240. We'll also remove the cruise to nowhere circuit breaker system. For the other measures, that is the number of people in a banquet, the RAT requirement for clients of bars and pubs, clubs and nightclubs. In the next cycle, these measures will stay. We will continue to talk to stakeholders and to make sure that implementation will continue to be smooth.
There are a number of questions from the general public about the vaccine pass arrangement, and I would like to clarify today. Starting from today, the applicable age of the vaccine pass will be lowered to 5. Children aged 5 to 11, if they would like to enter premises where vaccine pass is required, they'll have to satisfy the relevant requirements, meaning that they'll have to have received 2 doses of vaccines, or that it has to be within 3 months after they have received the first dose. And for those aged about 12, the vaccination interval will reduce from 6 months to 5 months for the second and third dose of vaccines. There is also a newly added function for the Leave Home Safe app. After you have updated the app, you can store up to 8 vaccination records. Members of the general public can also present the printed version of the vaccine pass or a photo of the vaccination shown through your mobile phone when you enter the premises. And we would like to remind the relevant premises that the above ways of presenting the vaccine pass are all allowed. Apart from boosting the vaccination rate to control the COVID situation, the government is continuing to provide different ways or means for the general public to get vaccinated. Starting from today, there are 4 COVID-19 community vaccination stations in operation to provide Sinovac and BioNTech vaccination services. And those aged above 60 will not have to queue, and they can get same-day ticket at the stations so that more people can get vaccinated. I would also like to let the general public know that winter is approaching, and apart from getting COVID vaccination, people should also get seasonal influenza vaccination. Over the past 2 years, due to the COVID situation, the number of people getting influenza is relatively low because people have been wearing masks. And there are worries that the number of people get infected by flu will increase. So starting from the 6th of October, elderly people aged 60 can also, apart from getting COVID vaccination, they can also get free flu vaccination. And you may make reservation online for the vaccination service. I hope that you will work hard with us to control the COVID situation and help protect your family so that the society can resume to normal soon. The floor is now open for questions. Please keep your questions concise and identify your media outlet. The lady on the right. I'm from RTHK. I have a question for Dr. Choi. You mentioned that cases of BA.5 had reached 85%. Does that mean that the COVID situation has peaked? And with the 0+3 arrangement, how great is there a chance to have a serious outbreak of COVID, do you think? I would also like to ask the Undersecretary for Health that for inbound travelers who have relatively mild symptoms, they can, at their own cost, stay in the hotel for isolation. Do you mean that for those with mild symptoms, they would not be sent to public hotels, but to the designated quarantine hotels? Such arrangement is implemented. Is it because it is to prevent an overloading of the public hospital services? Thank you. Dr. Choi, thank you. To respond to the question about COVID situation, as you may see over the past 2 to 3 weeks, there is a change of the situation. From the peak, we have now slowly come to a stabilization with about 4,000 cases every day. And we have also paid attention to the sublineage. With BA.5, there was a small percentage at the beginning, but now it's reached 80%. Some of the sublineage with about 80%, it's now the most prevailing variant. So if you look at the percentage of the variant or the number of cases over the past few weeks, the situation has come to a plateau, and we expect that the COVID situation will slowly ease off. That's why we are adjusting our measures, and some relaxation of arrangements have been announced. It's hard to expect the upcoming trend of the COVID situation. The reason why it has come to a stabilization because of a high vaccination rate, but there is still a group in the society with a relatively low vaccination rate. So if we see an outbreak among those group of people, there may still be a serious COVID situation. And also the immunity level will drop through time. So within 3 to 6 months after you get vaccinated, your immunity level or antibody level will drop. But still, vaccination is effective in preventing death or severe cases. So whether we will have another outbreak of the COVID situation, it will depend on our immunity level and the vaccination rate. Of course, we'll have to look at the scientific data as well. In winter, the virus may be more active, and it will also increase the transmission rate. But so far, the situation is relatively stable, and that's why we're relaxing some of the measures. Let me answer the question regarding in situ isolation arrangement. The idea is that it is similar to be isolated at home, like the locals do now, and we believe that it can effectively control the transmission situation. And referring to our past records, there are relatively few serious cases for imported cases. And facilities are precious, and our objective is that for people with mild symptoms, they will not have to be hospitalized or receive treatment at hospitals. So it really depends on the condition of the patients. We have also taken into consideration the benefits of the patients, and if you have to move the patients from one place to another, it involves transportation and other arrangement, and it may cause viruses to spread as well. We would like to make good use of our resources, and to minimize the transportation of patients, we suggest the in situ isolation arrangement. The gentleman at the back.
I'm from cable TV. There are experts saying that the Leave Home Safe app should be removed, but now you ask for young children age 5 to scan the code. Is it the case that the government policy is not quick enough to respond to the situation? Previously, you said that when service capacity of hospitals authority reaches 80%, then the social distancing measures can be further relaxed. But how come that the prohibition of group gathering stays at 4 people? Regarding in situ isolation, now we don't have quarantine hotel. Does it mean that the people who are under isolation may stay in the same hotel as other people? First of all, Leave Home Safe app, and now those above the age of 5 will have to use Leave Home Safe app to enter premises. The policy intent is to protect high-risk groups in Hong Kong. That means the young and the old. For these two groups, there is huge room for improvement in terms of vaccination. We ask you to strike a balance between the risk and the inconvenience. We appeal to parents to take their children to get vaccinated. Vaccination is safe. All over the world, over 1 million doses have been administered. Complications and serious complications are very rare. So apart from prevention measures, say for example, wear a mask and wash your hands, the best way to protect yourself is to get vaccinated so that there will be a boosted level of protection to effectively prevent serious cases and fatality. For high-risk groups, they need to get vaccinated. It's very easy to get vaccinated. We do ask you to get vaccinated. And you ask for in situ isolation. Does it mean that they will be isolated with other members of the public? We have visited hotels and we have spoken to hotels, and we will continue to do so to explain to them what measures they can put in place as prevention and control of COVID in order to reduce the risk of transmission. In fact, those staying in hotels, if they have contracted COVID, their code will turn red. That means they are not allowed to leave the hotel to mingle with those who are not COVID positive. This is actually an effective way to segregate those who are COVID positive and those who are not. This can reduce risks. After we have launched the red and yellow code, we find that it is a very effective way to separate confirmed patients by stopping them from going to high-risk locations to spread the virus. Gradually, the service capacity of the hospital authority has been increasing. Non-COVID patients are in great need of hospital services, and they've been seriously affected in the past. So we do hope that the service capacity can go back to full. But does it mean that as soon as it reaches 80%, then like flicking a switch, all the measures will be lifted? It's only been a few days since we have seen the relaxation. It will be premature to say whether the measures are effective. So we will carefully go over the data and monitor the COVID situation, and at appropriate times we will make adjustments. We ask for your patience because it's only been a few days since our last relaxation. The one in black on the left.
Can you explain why that now is the right time to allow inbound travelers, if they're infected, to quarantine at the hotel? Isolate at the hotel if they're infected with light symptoms. You mentioned about the risk of infection during transportation. What changed that now is the right time to let them isolate on site? Would that actually increase the risk of them of having outbreaks at quarantine hotels? That's question number one. Secondly, about the relaxation of social distancing measures next Thursday, is there a chance that we can see more relaxation going forward? And what would be the indicators, the criteria to allow further relaxation, such as like dropping the mask orders at outdoors? Thank you.
Okay. Thank you for the question. It's mainly about the in situ isolation for the inbound traveler. What is the risk of transportation? Why we do it now but not then? Basically, when we look at the numbers of positive patients, positive inbound travelers throughout all these days, the percentage of those being positive are not that huge. From the last round figures, we think that we see that basically it's only around 3% of inbound traveler will be positive within like 7 days. And then so the amount of these positive cases will not be that huge. Another thing is about the risk of transportation. We always think there is a risk of spreading the infection when we allow the positive person, the infected person, to travel around, at different places. That is the whole concept why we introduce isolation, why we introduce red code, so that those positive or infected cases cannot go around to public areas, because the risk of infections or actually spreading the infections is huge. And this is all our effort to minimize this spread, including minimize the need for transportation. So if there are means that we can reduce the transportation, we are very eager to adopt the approach. So with more experience built up in the hotel industry, when we actually are more confident, we are actually more confident to handle the positive or infected cases within the hotel, with the infected cases having a red code. That means they cannot go out or leave the room. This is the whole concept about isolating them to minimize their chance of spreading the disease to the others. Of course, government will actually go to the hotel industry to educate how to prevent the spread, what measures they have to be introduced in order to minimize the outbreak in the hotel. We will keep an eye onto that, see whether there will be any outbreak in the hotel after the introductions of this arrangement. Concerning the criteria for the social distancing relaxation, we understand that as a Hong Kong citizen, we all want to actually have a more relaxed social distancing criteria. Actually, we want to get back to quite a normal life. Yet, we still need to do it step by step carefully, because the things that we want to avoid is actually rebounding. Sometimes we close it, sometimes we relax it, sometimes we close it and relax it again. It is actually not quite helpful or not quite useful for the industry or for Hong Kong citizens. So that's why the whole government wants to introduce the relaxation step by step, slowly, to actually minimize the rebound. And also, we have to keep watch to the data, to the number of infected cases since the relaxation of the inbound traveler. Today is only the 5th day after the relaxations of the inbound traveler quarantine arrangement. Any effect from the relaxation will not be actually seen with only 4 days number. So probably we need to have a longer period of time, like at least weeks, before we can actually see whether we are going to a right direction or not, or what other measures we can actually relax. So I would plead for a little bit more patience about the relaxation. Oh, okay. At this moment, for outdoor activities, if you are doing sports activities, you actually can take off your mask. But if you want to take a picture at the outdoor, still under the current situation, it is not allowed. We would like to review this, and hopefully it can be, at some stages, can relax as well. If the whole disease, if the whole conditions in Hong Kong is actually under control, this is actually on our list, and hopefully we can actually review all the measures, and then in a paced way, we can actually relax one by one.
好，下一個提問，最後排黑色衫嗰位男士唔該。
The gentleman at the back. I'm from Oriental Press. The original idea for the Leave Home Safe app is to track the cases. Is the government still using the app to track the cases? The government is always stressing the importance of Vaccine Pass and Leave Home Safe app. So what are the true functions of these two arrangements now? It was said that at catering premises, the maximum number of persons allowed is from 8 to 12 now. If there is a group of 12 persons in catering premises, do they have to do RAT tests? And there are reports that inbound travelers, when they arrive in Hong Kong, they did not receive messages from the department. How would the department track the people who did not do RAT tests? Currently, everyone who goes to the scheduled premises or the premises requiring the Leave Home Safe app, they have to scan the QR code. If we suspect that there is a super spreader situation, we will use the app's info to track the cases, and we will ask members of the public to provide the relevant information from their app so that we can more effectively trace the cases. And we implement these measures with other measures to control the pandemic. As for a group of 8 persons, that is, if there are more than 8 persons and catering premise, then RAT tests will be required. For people traveling from overseas, they'll have to do a health declaration. It is an electronic health declaration form. After the declaration, when they arrive in Hong Kong, they will get a temporary vaccination pass, which is with a yellow code. It is not connected with the phone number, but it will update with the app. So even if the traveler does not have a local phone number, as long as he or she gets Wi-Fi, it will be able to connect to the app. So when travelers arrive in Hong Kong, as long as there is Wi-Fi, the relevant vaccine pass will be updated. So it doesn't matter whether the travelers are using overseas phone number or local phone number. As for receiving messages, when the travelers arrive in Hong Kong, as long as they can provide a valid phone number which support roam services, they will receive the test result, PCR test result, through SMS. I'm from Orange News. The applicable number for vaccination pass is lowered to 5 years old now. So I would like to ask the Undersecretary for Health whether relevant risk assessment has been conducted. And why are there tightened measures for the children? And are there any cases or adverse events reported that involve children or young people after vaccination? As for the vaccination exemption certificates, among the 20,000 fake certificates or deceased certificates, how many of them are real or still valid? Perhaps I would first respond to the question from Oriental Press regarding vaccination pass or the catering premises requirements. If there is a group of 12 persons in catering premises, you'll have to do RAT test, not for a group of 8 persons or above. Sorry. As for the question about reports of complications among children, I would ask the doctor to answer your question. For children getting vaccinated, there are always adverse events reported. It's just about the percentage of adverse events reported. It's been quite some time now after COVID vaccination has been rolled out, and we are mostly getting mild symptoms after vaccination, including small fever or pain around the injection wound. And according to scientific data, vaccination is still safe for most people, so the general public need not to worry too much about that. As for children who have received vaccinations and have facial weaknesses or facial muscle weaknesses, I think it is a relatively mild symptom. And to respond to the question about vaccination exemption certificate, we are concerned about the situation. The police is carrying out investigation now, so we're not able to disclose too much detail to the public now. We're concerned about the situation because the document may not have been verified properly. So the government has made the decision that after the 12th of October this year, these documents will no longer be valid. So those who have got the certificates from the involved clinics, they can consult other doctors. With reference to the previous data, people who are not suitable for getting these two types of vaccines are minority. So, upon consultation from doctors, I believe most people are suitable to get vaccinated.
Last two questions. The one on the left in black. I'm from Mingpao. I'd like to ask more about social distancing measures. Just now, the Undersecretary said that she would need more time to get a better understanding of the impact of 0+3. So how come that for other measures in the past, say for example, all the prohibitions and limitations, they have not considered that? Do you undertake that there will be only relaxation and not tightening in the future? About Leave Home Safe app, just now you said that well, it is for use when there is a suspected outbreak. But in the past period, what was the frequency of using that? But for members of the public, if they want to go out, they will have to use the Leave Home Safe app, and that's the cost they pay. So how effective has it been, and what is its effectiveness? And just now, the Undersecretary said that, well, for imported cases, there are few serious cases, so or admissions. Can you give us an actual figure? Let me first talk about the impact of 0+3. We don't have the data at hand. We will have to provide it afterwards. Well, as you understand that for 0+3, we only have 4 days of data, so it is impossible to have an accurate assessment of the situation, whether there will be further relaxation. With more time, there is a chance that we'll be able to arrive at a decision. In relation to adjustments of our social distancing measures, we base our decision on a number of factors. First, number of cases. Two, the local health situation. Apart from local cases, as you've heard from Dr. Choi, in the past week, it has been quite stable. It has reached a plateau. We have not really seen any major outbreaks. We bear in mind the need for economic development, the need for resumption of normal activities of people's lives, and also to open ourselves to the international community. We also hope that members of the public will be able to enjoy more convenience in the conduct of their everyday life. But we ask for your patience and understanding. Where possible, we do hope that we will be able to reach there step by step. I'm afraid I cannot give you an undertaking that there will only be relaxation, not tightening, because when it comes to fighting the epidemic, we cannot rely on the government alone. We need the support of the public, and we rely on your sense, your awareness to protect yourself. We ask you to get vaccinated, not just to protect yourself, but it's for the good of the community as well. We are concerned about the winter influenza when winter is round the corner. With COVID plus influenza, it doesn't look good. Data from overseas countries show us that COVID plus winter influenza does not end too well. So we have to be quite vigilant. Can you give us your last question? It's in relation to Leave Home Safe app. Just now, Dr. Choi said that in tracing a large outbreak, Leave Home Safe app would be effective. When was the last time when you used the app to track cases? How effective was it? Now you require members of the public to use it every day wherever they go. Compared to the need for tracking cases, how effective is it? As I mentioned, a merit of using the Leave Home Safe app is that we can track the whereabouts and places they visited. in the past 30 days. Sometimes when we're trying to trace the places they visited, they might not remember. But by using the app, we are able to accurately record the places they visited, and we can also compare the information to see if there are other people who visited the same premises at the same time. We have to consider a number of things. The trend of the COVID situation. You're right, yes, the COVID situation is stable, and we don't find large-scale outbreak as often as we did. So the need for tracking is diminishing. The second factor is the convenience of use for members of the public. Now members of the public have formed the habit to just scan their Leave Home Safe app whenever they leave and enter a premise. And as to whether there will be any change, I believe that the government will consider that. Well, that is, in terms of Leave Home Safe app, social distancing measures and other measures, we will keep all that in view. Last reporter, I'm from TVB. Well, barbecue is not allowed in country parks. Today we see some relaxation. How come there is still the same restriction for barbecuing activities? Are you concerned that there will be large outbreak with the relaxation? What's the criteria in choosing what scheduled premises to receive the relaxation? When will you relax the requirement to wear a mask? When can people be free of the mask? In terms of adjustments to social distancing measures, it covers catering premises, bars and pubs, clubs, nightclubs. We believe that there will be adjustment corresponding to changes of the COVID situation. At this moment in time, we have to tread very carefully. We also have to take a gradual approach towards resumption of normalcy. But our decision has to be supported by evidence and by data. We need to be precise when it comes to our adjustments. But don't worry, we continue to monitor the COVID situation. At appropriate time, we will make adjustments of these measures and we will announce them. Thank you very much. Sorry, speakers off mic. The interpreter cannot hear. We have already covered that. We hope that we will be able to do it step by step instead of doing it at one go. When we have more data, more evidence, we will make adjustments to other social distancing measures. Thank you very much.